Hi guys, Ariana here at the AAFE Training Center. I'm super excited to walk you guys through this thread lift that I'm doing on my patient. We opted for full face thread lift, and she has actually never had it done before, so this was her first time. I have seen her previously for neurotoxin in the upper and lower face, so we did do a full face of tox about 2 weeks prior to this. I like my patients to be toxed fully before I do any kind of filler, threads, biostimulation, etc. I just kind of want to see the face at rest. And I also want to relax that muscle pull that could possibly be moving these threads around. For example, around the crow's feet or for her along that jowl area when you have a really strong platysma bands. It's trying to pull and counteract that lift that we're getting, and it kind of works in gravity's favor and pulling down and down and down on that jowl. So for her, relaxing the platysma band, I toxed her mentalis, DAO, crow's feet, glabella, and frontalis prior, and a pretty heavy dose. So I'm kind of seeing her back on full rest and getting excited and having her mentally prep for a PDO thread lift as well. So something else I want you guys to keep in mind is, why did I opt for a thread lift? Why did I not opt for a laser or Sculptra or hyperdilute radius or filler? So for her, looking at her skin, I really needed some help in the collagen and elastin department. I really wanted to help some textural issues. She doesn't necessarily have discoloration, but I really wanted to help with some of those thick, kind of scarred tissue that she has going on. And I'll also get a lift on top of it with that collagen and elastin stimulation that the threads can do. So for me, it's like a win-win situation. If I were to opt for filler, I wouldn't get that collagen and elastin stimulation, and I'm also not getting much of a lift. I also would have needed a lot more filler had I opted for that first rather than doing a thread lift. I kind of explain it as I'm priming the wall before I paint it. I need to prime the tissue, and I need to make sure that I am building collagen and elastin before I try to go in with some filler. With that being said, I'm very excited to see her 3 to 6 months later, not only for the lifting effect, but for that collagen and elastin stimulation and what it can really do for her skin. So going in here with the PDO lift, I did sit her all the way up to be able to draw my lines. I want to see how the face is resting fully when the patient is sitting upright, and that's when I draw my lines, because everything can kind of change when that patient immediately lays down. Things start to disappear or move or fall back, which is why I kind of trust my lines once I make them. So for her, I just went in with some lido and epinephrine to numb the porthole, and then I used an 18 gauge to create the porthole. And then from there, I numbed each track and created a track with a cannula using just 2% lidocaine. And now I'm going in with my actual threads. So I really like to use a twist in advance method. I do this often because it helps me get in the tissue, but I also really try to cause as minimal amount of trauma to the skin as possible. So for her, that's kind of why I do that. I also do this when I'm using a cannula with filler. And I think that it helps me get in there quicker and get into the right plane, which of course we all kind of want to make this procedure as painless and as easy as possible for both the provider and the patient, which is why I kind of just pull my tissue over the cannula, keep advancing, and keep things moving along. The worst thing is when you're kind of just sitting there and pushing and pushing and pushing and not getting anywhere. It's very uncomfortable for the patient. You're causing them pain, which makes you uncomfortable as the provider. So just trying to move forward as long as you're in the right plane, and keeping this train moving along is very important when it comes to PDO thread lifts. Obviously, don't, go super quick and fast, but keep that in the back of your mind, that keeping that train moving and making your patient more comfortable is ideal. So for her, I have 2 threads done. I actually contemplated doing 2 threads to the jowl, but rather than doing that, I opted for 2 threads to the jawline. So this is a 3-vector with a vector, 2 vectors bilaterally to the jawline, which actually gave me a really, really great result that I'm super happy with. It's also really nice when I can treat patients full face. In my opinion, I always say to my patients, if you're going to do the thread lift, let's do the whole thing. Let's do a full face, because this healing for just neck and the healing for just cheek is the same as the healing for cheek, jawline, and neck. So if we're going to have 4 weeks of downtime, let's just do the whole shebang and let's give you a great result and not need to keep doing thread lift after thread lift. So I like for my patients to just heal and have those 4 weeks of downtime and be good for at least a year. Okay, so here I am just again numbing that jawline, and I am going to do the 2 vector here just because I really wanted to tack back some of that tissue, and that was, in my opinion, as the provider, the biggest area of concern was that jawline and the jowl. So I'm working my way around. This can be a little pinchy by the mouth just because of our nerves around our mouth here. And I just tell my patients, let me know if you're feeling uncomfortable. I can always pop in just a little bit more of numbing if need be. So yeah, here we are. She has had a great result so far. It's only been a week, so post-care is still about 3 weeks of possible bruising and swelling, but I do keep up with patients a lot when it comes to my thread lifts. I'm constantly in contact with them. I want to know what's going on, where everybody's at. Look at that jawline. I'm sorry, I'm interrupting myself just to look at that jawline. I think she looks great, and I haven't even pulled at them yet. So here I am just engaging them. She had a massive concern for her neck, so we did do 2 bilaterally, but I'm also thinking of pairing it with hyperdilute radius down the road, possibly more PDO thread lifts. We can do smooth threads in the submental. You can do Sculptra in the neck. You can do so much in the neck to really help with skin quality and texture. So with that being said, I clip before I do the neck. Some providers go right to neck and wait until the end, but here I am just having everything engage and kind of working my way to get everything to engage. Some providers really love this part because it's kind of a satisfying feeling. I personally don't like it. I feel like I'm causing the patient trauma and discomfort, which is the worst. None of us ever want to be causing our patient any kind of discomfort. So with that being said, I'm just working those threads in to be engaged where I want them to be, and then putting Band-Aids on. So she can take those Band-Aids off, I say late that night. So if I treated her, I think I treated her in the morning, she can take them off right before she goes to bed, or I tell them the next morning. Some patients are very adamant about it. I had one patient tell me that she didn't take them off for 3 days, and I was like, well, you didn't have to do that. That's going a little overboard. So just remind your patient why you're doing it. The big thing is to keep those sites clean and, with no bacteria. So as long as your patient's keeping that area clean, there's no concern for infection, then I'm happy. So it doesn't need to be on for 4 days. So keep that in mind when you're talking to your patients. Post-care is so important with threads, arnica, fluids, icing, heating, all the things to make your patient have really great results is going to be key. So, look at her jawline from that jawline thread and the neck threads. I haven't even pulled them tight and they're helping so much already. So this patient was beyond happy. She's going to have her peak results 3 to 6 months. And then when that collagen and elastin starts to stimulate and they notice the quality in their skin looking better too, they're even more excited. Which is my favorite part. I always tell patients if you can get past that first month, then you are smooth sailing and you are going to have great results. So here I am just tightening. Same thing after this She did have some pretty big hematomas in her neck, nothing to be concerned about, but it is giving us a false, not as tight of a look, which is totally normal. The fluid, the swelling, all of that will go down. And here I am just engaging, Band-Aid, and then she's good to go. Of course, after the other side. But all right, guys, take care. I hope you enjoyed watching. And here's her side by side. She looks fabulous.